If you're a time-poor allied health professional like me, you've probably noticed that there's a lot going on in the NDIS reform space. In this video, I'm going to try to bring you up to speed. For those of you who don't know me, my name is David Kinane, and I'm the principal of Banter Speech and Language, a speech pathology clinic based in the inner west of Sydney. I'm also the principal of the Provider Loft. So I'm going to kick off the discussion today by talking about why I'm so invested in NDIS reforms. Then I'm going to move on to covering what the main NDIS reforms and other developments are. I'm going to then venture a few guesses and predictions as to what the potential implications are going to be for allied health providers. And then, of course, I'm going to invite questions and comments. Let's get to it. Now, over the last couple of years, you've probably encountered a fair bit of anti-provider sentiment coming from parts of government, coming from social media, coming from some sectors of the media, and it's important not to be distracted. The purpose of NDIS reforms is actually not about us, at least not directly. It's about making things better for participants and, of course, making sure that the NDIS survives. Almost everyone thinks that the current system can be improved, and most of us think that it can be improved quite a lot. And I think it's really important to remember that reputable allied health providers have very similar interests to participants in making the system better and sustainable. I think we all recognise as well, especially those of us on the front line, that there is no way we can make the system better for participants without participants co-designing and collaborating at every stage. So why am I so interested in this whole thing? Why am I so invested? As a speech pathologist and a lawyer, NDIS reforms bring together, very nerdishly, my two great professional passions. More importantly, though, I've got skin in the game. Each of my businesses will be affected by NDIS reforms, and it's really important that I adapt to them wherever possible. And it's not as if NDIS reforms are happening in a vacuum. Even if they weren't happening, we're encountering some of the toughest times that I can remember as an allied health professional. I'd read all of these bullet points, but frankly, they're too depressing. Any reforms of this scale are going to create additional risks for people who are operating in the industries affected. It's also true to say that reforms can bring opportunities, and for both reasons, we need to track what's happening pretty carefully. There's certainly a huge degree of regulatory uncertainty, and it's likely, as I'll talk about in a while, that we're going to be under some additional constraints. And it's also true that depending on which way the reforms go, we may see the demand for our services, the supply of our services, our costs and our cash flows, service deliveries and business models all changing pretty radically over the next few years. And it's also true that we're doing this against this backdrop of anti-provider sentiment that I talked about before. Tough times indeed. So what are these key developments? Well, I'm going to run through them now and pay attention to two things. First, there are a few themes that recur as we go through. Second, notice how the timelines are getting tighter and tighter and how the rate of change is accelerating. These are both really interesting things and important things for us to know as we start to plan how we're going to adapt our services to meet the needs of the new regulatory frameworks. So we can start the tale all the way back in December 2021, when Australia's disability strategy for 2021 to 31 was released. In this report, there were 31 priorities identified, including to improve mainstream services. Now, this is one theme that you will hear coming up again and again. In November 2022, the Fraud Fusion Task Force, a task force made up of 19 government agencies with an excellent name, was established to crack down on, quote, dodgy providers and others. Now, I think everyone accepts that there were not enough checks and balances when the NDIA and the NDIS were set up. And if you look at current estimates, something like 5% or $2 billion a year is spent on things that are not legitimate. Now that's interesting. That's the second theme. In December 2023, the independent NDIS review released its recommendations, and it recommended lots of things, including new legislation, foundational supports, navigators, and mandatory registration. All of these are themes that we're going to come back to in just a second. So in March 2024, the government introduced its new legislation, the National Disability Insurance Scheme Amendment, getting the NDIS back on track, number 1 bill of 2024. It's quite a mouthful. Inside the bill was a new proposed definition of NDIS supports, as well as a very radically different idea of how plans should work and how budgets should work. We'll come back to that in a moment. In June 2024, an OT provider was jailed for 6 years for NDIS fraud. It was a really serious case, and this quote from the press release stood out and should be read by all allied health providers. "I know this case is a minority, but let this be a signal. Whether you're an allied health professional or you work in another field supporting participants and you're doing the wrong thing, it will only be a matter of time before it catches up with you." That's directly from Bill Shorten. On the 1st of July 2024, the NDIS pricing limits took effect, and wasn't that quite a disappointment? For the 5th consecutive year, there was no increase. On the 2nd of August 2024, the government released the NDIS Provider and Worker Registration Task Force report. I remember this day well because I was halfway through writing a blog about it at the time. So it was kind of inconvenient timing, but actually quite promising for allied health providers in the sense that it suggested that existing ARPA registration may suffice for registered allied health professionals, and it also suggested that for some self-regulated allied health professionals, certification or membership of their peak body may suffice. Now, the devil is in the detail, and there's lots of caveats, and the government, of course, has yet to respond. But this could be quite interesting and useful for allied health providers if it's accepted by the government. Interestingly, at various points through the document, the task force is clear that their recommendations in relation to registration only and do not apply to worker screening. Worker screening and worker clearances are a big theme in all of the NDIS reforms we're going to be talking about. On the 4th of August 2024, the government released its draft transitional rules around the meaning of NDIS supports, which were widely interpreted as the ins and outs, things that would be funded by the NDIS and things that wouldn't be funded under the transitional rules once the bill took effect. It was a really short consultation, and there were some things in there that made complete sense. So you couldn't spend money, for example, on gambling or alcohol or international holidays, that type of thing. Importantly for us, the ins included allied health, early intervention and therapeutic supports. They excluded alternative and complementary therapies, and they also excluded mainstream health, childcare, education, employment, and justice supports, just as, for that matter, the current rules do. I think it's well worth remembering, though, how many of our clients are affected by mixed health, disability, and education issues, which I think in practice is going to be very messy to navigate as we see the new rules. On the 22nd of August 2024, the new NDIS Amendment Bill passed Parliament. Importantly, it doesn't commence until the 3rd of October, but the bill as passed will clarify the basis on which people get access to the scheme. It will in the future enable better early intervention pathways. It will provide clearer information about how flexible budgets can be spent through the new definition of NDIS supports, again, when the rules are released, and it establishes a legislative claims and payments framework. On the 28th of August 2024, the NDIA, as part of the Fraud Fusion Task Force, released a press release basically saying that it was intensifying investigations to catch crooks. This quote caught my eye. "I want to be really clear to everyone. Whether you're a registered or unregistered provider falsifying claims, or a dodgy health practitioner falsifying assessments, or a dodgy tax agent facilitating NDIS frauds, or a dodgy plan manager facilitating false claims, or a sophisticated criminal group doing all of the above, you will be caught. On the 1st of September 2024, the NDIS Commission reported that they'd banned a record number of, quote, dodgy providers. On the 3rd of September 2024, the NDIS Commission released its second version of its enforcement policy. A couple of things caught my eyes. Strong investigative enforcement powers to identify and take tough action against unscrupulous and negligent providers. Monitoring of providers to examine whether they are complying with their legal obligations. We recognise that many providers comply and want to comply with their legal obligations, which is a good thing for them to say, and we work to ensure that providers have access to the same information we use in our decisions and tools needed to support compliance. Again, a continuation of many of the themes that we've talked about so far. On the 4th of September 2024, the NDIA released its Quality Supports for Children Guide for families. If you work in the paediatric space, it's well worth a read because it highlights a number of the themes that we've talked about so far. On the 5th of September 2024, the NDIS bill received royal assent, which meant that we have a commencement date, the 3rd of October 2024. On the 16th of September 2024, the government announced consultation on the first part of its mandatory registration program, focusing on support coordinators, platform providers, and SIL. And this bit caught my attention. I am committed to progressing reform that strengthens risk-proportionate regulation to increase the quality and safety of NDIS supports. That's Bill Shorten again. Around the 18th of September, many of my clients who are participants in the NDIS started to receive emails from the NDIA CEO. And basically, the purpose of these emails was to update participants on the new rules that will take effect from the 3rd of October. So this is some of the content of those emails. From the 3rd of October 2024, there will be a new definition of NDIS supports. This definition makes it clear what NDIS funding can and can't be spent on. This change will affect all participants. If your plan is reviewed after the 3rd of October 2024, your new plan will have a total budget amount. This means you'll see a total amount for all supports in your plan. On the 19th of September 2024, the NDIA commenced civil action against a provider for restrictive practices. This is another theme that we'll come back to. On the 19th of September 2024, a disability reform roadmap was published. It's very helpful, and we'll look at it in a little while. You've probably noticed that the rate of communication around the reforms and the proposed reforms is accelerating. As we head into September, we're getting press releases almost every day. So on the 20th of September 2024, the DSS kicked off its Foundational Supports General Supports consultation. I've read that report and I've written my thoughts about it for allied health providers in this blog over here. First Foundation Supports consultation has kicked off, 8 things for allied health providers to know. On the 25th of September 2024, the acting NDIS Commissioner wrote an open letter to platform providers highlighting the need to inform workers about the NDIS Code of Conduct and best practice of screening workers and other matters. So there's worker screening coming back to the fore. So there are all sorts of rumours happening at this point of time, and on the 26th of September 2024, the NDIS Commission updated platform providers that changes in regulations actually require rule changes. They can't happen just by way of press release. So that was really interesting. But what was also interesting was the note in their press release that core requirements include the Code of Conduct and NDIS practice standards, complaints management and resolution systems, incident management systems, and worker screening. you'll see that those parts or those elements of a compliance program are elements that the NDIS Commission continues to highlight in multiple consultation documents and multiple press releases. On the 26th of September 2024, the NDIA announced forthcoming conflict of interest resources relating to the NDIS provider market. We're going to be released within the next few months. That's something for us all to pay attention to. On the 26th of September 2024, the Minister announced an independent pricing committee to review how NDIS price limits are set and to investigate if there are more effective approaches. I have to think there are. Now, interestingly, they're going to report back to government with a first tranche of recommendations before the end of this year. This is something that I know we're all going to watch out for carefully. Now, before the 3rd of October 2024, we're also going to get new transitional rules for NDIS supports. I'd love to speak more about those, but unfortunately, as at the point of this recording, they have not yet been released. So, on the 3rd of October 2024, the new Act takes effect. And there are a few things I think you should know. The first is that within the new Act, there's going to be a new transitional definition of NDIS supports. This is going to affect all participants, and it may also have knock-on effects to new applicants for access because they're going to have to show that they're likely to require NDIS supports for their lifetime. When new participants get access to the scheme, they're going to list the categories of impairments the person has met, which will include intellectual, cognitive, neurological, sensory or physical, and psychosocial impairments. And these will be linked to the supports that the participant can access. So that's going to be a big change. So let's talk about plans and planning. So plans will be eventually developed based on a needs assessment. But at this stage, we have no idea how those will work. There needs to be a lot of consultation done on that. Until that's worked out, we're going to stick with the reasonable and necessary as the way that planners assess supports. But that concept of qualifying impairments will continue to inform what's fundable, and NDIS supports as a concept will replace the most appropriately funded by the NDIS test that's in there at the moment. New plans are going to change. They're going to state a total flexible budget, a stated budget, and a plan period. The default will be 12 months, and the management style, whether people will be self-planned or NDIA or agency managed, as well as the qualifying impairments of the participant. Compliance is going to be a bigger thing under the Act as amended. If someone spends funds on a service that is not an NDIS support within the new meaning of that term, the NDIA can take a range of actions. They can change the management style, so they can take someone off self-management and make them plan managed or even agency managed. They can impose a shorter plan period on the participant, or they can even raise a debt, which after some amendments were passed at the last minute, a person can ask the NDIA to waive. It'll be interesting to see how this actually works in practice. The NDIA can also request information or ask a person to undergo assessments to test or retest their eligibility for the scheme. And if a person doesn't comply within a reasonable time frame, the NDIA can revoke access. In other words, kick them out of the scheme. That's a really big deal. And for us as providers, we need to be careful to make sure that we put our claims in a timely way, because claims are going to be limited to a 2-year period. Some transitional rules will apply though. For existing participants, there are no changes to access. A participant is going to continue on what is called an old framework plan until rules are developed and new planning frameworks commence. As part of transitioning to new framework plans, participants are going to receive impairment notices which detail their impairments that meet the disability or early intervention requirements, and this will be subject to internal and external merits reviews. We really don't know the exact timeframes when this will all be worked out. So this is the roadmap that I was talking about earlier. And if you haven't had a chance to look at it, I recommend spending a couple of minutes just going through particularly the rows at the bottom of this diagram. I'm going to link to it below so that you can have a look for yourself. It's quite hard to read on this slide. Whew, that was a lot. Even just running through some of the main events and summarizing the key provisions is enough to make me tired without even thinking about what I need to do to actually get ready for these changes that are happening right around me. So let's now switch to the potential implications and some of the emerging themes that we can derive from all these various changes. So at the outset, I have to confess that forecasting is not my main job, but there are some things we can do to try to improve the accuracy of our forecasts, of our predictions of what's going to happen. I've listed some of the qualities that tend to improve forecasting ability, at least in the short run, on this slide. So now that I've got my lawyerly disclaimers out of the way, let's talk about my predictions. Well, the first is I think we're going to see more regulation. It's probably not a shock. So I would expect that it's almost guaranteed under any scenario that we are going to have to go through worker screening and registration processes. Even if our current regulations are sufficient for registration purposes, it's really clear that worker screening is important to the NDIA and it's a good thing for us to do. So that's probably something that we should all prepare to do if we haven't done so already. It's likely that we are going to have to register in one form or another. The question is, what will that involve? How much work will that involve and what will the costs of that be? Now, if we are registered under any scheme, this may have knock-on effects to pricing and pricing limits. Remember, if we're registered, we're not going to be able to charge above the pricing guidelines, even for self-managed clients. That could be a big deal for some providers. It's likely for some classes of self-regulated professions that, depending on where we come out on NDIS registration, there may be some knock-on effects for how some classes of self-regulated allied health professionals, like, for example, speech pathologists, are regulated. Again, we don't know what those will look like, but there could be some changes. We should expect more regulatory monitoring of what we're doing. We should expect higher compliance costs as we start to put in place new compliance systems that need to be tested and that we need to train staff on. And it is possible that we will see some providers decide to exit the NDIS and working with NDIS participants, but some of the things that we've been talking about may also be relevant for foundational supports within mainstream settings. And that could be a real issue for people who do a lot of work within mainstream settings already, like, for example, within schools or within childcare centres. So another key theme that's coming through multiple documents, including press releases and consultation papers, is the fact that governments and regulators are going to increase their expectations on providers, including allied health providers, to raise our game. And so even though we should expect more anti-provider rhetoric, we can't do anything about that, especially in relation to some of the bad apples in our industry. It's really important that we raise our standards. So this will involve a whole number of things in my view. First of all, I expect that disability training is going to have to improve. I think there's going to be an expectation that we will gatekeep. In other words, we will help regulators and others in terms of talking to our clients around access, around things they can spend their funds on and things they can't spend their funds on under NDIS supports, the new meaning of NDIS supports, as well as options that exist outside of the NDIS to get help, especially as foundational supports are rolled out over the next 5 years. I think there's going to be more local navigation support required for allied health providers, which in turn means that we're going to have to get better at working within local networks to be able to help our clients to navigate them. Multiple documents talk about the need for increased transparency on our services on the qualifications of our team members and on their experience. So I think one of the themes will be making sure that we increase transparency around all those things in our marketing materials, including our websites and social media. And stamping out restrictive practices is clearly a priority for government, and it's something that we as providers should all be participating in actively. If I were a betting man, and I'm not, but if I were a betting man, I would suggest to unregistered providers that they may want to start benchmarking their standards, the policies, and their procedures to registered provider standards, especially on some of those areas that we've talked about so far, including complaints, worker screening, and incident reporting. This is particularly so you don't get caught out in the event that the government suddenly ratchets up standards or regulators ratchet up standards in those areas. I predict that there are going to be some significant service delivery changes rolling out over the next 5 years, and we should start to get prepared for some of them. So anecdotally, it seems like the agency is getting a little bit more aggressive in not pressuring, but in encouraging participants to be plan managed rather than self-managed. I think there's going to be a lot more emphasis on our need to report functionally, both in our assessment reports as well as in our outcome measures. We're going to have to get better at talking about how we increase participation and what we do to build capacity of our participants towards their goals. We're going to have to get more flexible in the way that we deliver our services. So I expect that many providers in this space are going to be asked to work more in mainstream settings, particularly childcare and education, as well as in home and community settings. I think that may have knock-on effects to how public health and private health providers interact with each other, and it's going to be very interesting to watch that emerge over the next 5 years. There's certainly going to be more requirements for us to be involved in multidisciplinary teams, and I think that's going to mean more meetings, more regular meetings with everyone surrounding a participant, which of course is a good thing. There's also going to be more emphasis on us as providers skilling up the people around us to provide support in the places that are natural for the participant to be participating. So indirect coaching and training models are going to become, I think, more common service deliveries, and we'll have to work out how that will work from a funding perspective. We'll also have to watch the navigator discussion very closely. I'm going to talk about that in a bit more detail because I think it could affect a number of us. And I think we're going to have to be clearer in our client communications. We need to be talking about NDIS language and concepts. Things like rights, choice and control, autonomy, and capacity building should sit at the center of our service delivery models rather than just being things that we put on our websites or pay lip service to. It might be a good time to conduct a review of your key strategy, your business strategy, starting with your mission. And to do that, I like Martin's framework here because it's simply 5 questions. What do we want to achieve and how will we measure our progress? Across the market or markets that we work in, where will we choose to work? And more importantly, where will we choose not to work? How will we compete and thrive wherever we decide to work? What new capabilities do we need to build if we're to succeed? And what management and compliance systems do we need to build to support our operations as the regulation of allied health professionals and the way that we work changes? I encourage all allied health providers to watch the discussion and consultation around navigators very carefully. These will replace local area coordinators, plan managers, and support coordinators, which is a $2 billion a year industry. But we're not as yet sure how they will operate. We do know that they will be available to everyone with a disability, not only participants. So that will also include people who are accessing foundation supports and people who are just accessing free information about disability. The navigator's job is going to be to advocate for the interests of people with a disability, independently of service providers and the NDIA. So an absence of conflicts of interest is going to sit at the centre of what they do, but it's not yet, to me, clear anyway how this model will work. So some of the models that have been proposed or propounded sort of include concepts of curation of providers. But I'm not sure how this sits yet with client choice and control. It'll be interesting to watch that. The timing of navigators and when they will roll out is pretty unclear. Some commentators think it might be as early as mid-2026, but that seems pretty aggressive. We're not sure how many navigators there'll be, or the regulatory status of navigators, what sort of background they'll come from. There have been some suggestions that may be as few as 5. It might be 15 to 20. It might be much higher than that. And it'll be really interesting to see where they land on that question. For many of us who are used to working with key worker models in early intervention, there's a concept of lead practitioner that's referred to in the NDIS review document, and it's unclear as yet how that will work and whether allied health professionals will step into those roles or continue in those roles. One suggestion I have for allied health professionals is that we all need to become fox-like rather than hedgehog-like. Foxes are able to do lots of things really well, whereas hedgehogs only do one big thing well. In changing times, foxes do a lot better than hedgehogs. So we should think about how we diversify what we offer so that we can become good at lots of things. We should also think about how we make lots of tiny incremental changes that are going to improve our flexibility to deal with a changing environment. So it's a truism to say that we're surrounded by lots of VUCA, which stands for volatility, uncertainty, complexity, and ambiguity. And guess what? That's not going to change over the next couple of years. Standing still, doing nothing, is risky, but betting the farm on changes that have yet to be agreed, have yet to be enacted, is also arguably even a bigger error. So I suggest that we should all get good at making small incremental changes, tinkering with our systems, moving directionally in the way that we anticipate change to be happening, but being prepared to adapt if things change radically or quickly. I think one thing to remember while we're doing that, though, is the importance of keeping our North Star clear. Knowing what our mission is going to be a really important reality check on whether we should make a particular change or avoid a particular change, depending on where we see opportunity and where we see risk. We need to remember our missions, and we also need to remember to practice self-care. It's a really stressful time for all of us. So one of the main reasons that I've made this short video is I think that we will work better as an industry if we work together. And the good news is there are already some people who share that view. And so, for example, have a look at Yellow Ukulele and the early childhood private practice community of practices work for examples of people who are actively engaged in the consultation to try to achieve outcomes that work for participants as well as for allied health professionals. So ends this short update. I'm sure there are going to be many more developments happening over the next couple of weeks, and we will do our best to keep everyone updated. We welcome comments, questions, and feedback of any kind. You can give me some feedback by sending me an email or by leaving a comment on this post wherever you find it. Thank you for your time. My name's David Kinane. Here are my contact details. If you've got any questions or comments, please feel free to reach out to me. Until then, good luck with your allied health provider business. Speak soon.